As the national COVID-19 vaccination programme progressed from its mobilisation phase to ongoing delivery, it became increasingly clear that the mass vaccination infrastructure in place to support the majority of the population was not suitable to meet everyone's needs. For some people, despite being prioritised as high risk, there were limited options in place to allow receipt of the vaccine in a bespoke manner. This led to uncertainty and, in some cases, delayed access. While it was quite straightforward to implement a mobile programme to get to the housebound or those within a supported living facility, it required a much more person-centred consideration to provide a tailored intervention for people with complex needs, such as a learning disability, severe mental illness, or needle phobia. The first step to providing a personalised vaccination offer was to recognise that people's barriers to accessing a vaccine can differ greatly. Our workforce has exceptional diversity, which includes mental health, physical health, learning disability, occupational health, children's health and pharmacy clinicians. Nevertheless, we also work in partnership with wider clinical and social services, families and carers to agree holistic plans that understand the needs and preferences of individual people and their loved ones. These plans outline any bespoke adjustments to offer the best chance of a successful vaccination and a positive experience. This could include changes to a pre-arranged vaccination clinic, perhaps vaccinating people in a quieter area or in their vehicle, or involve a schedule of visits to a person's home or care setting to help them become desensitised to the presence of the visiting clinician. These visits help the vaccinators forge trusted relationships with people they are supporting and deploy distraction techniques such as storytelling and play therapy, which help to reduce stresses, anxieties and phobias towards clinicians, procedures, vaccines or needles. Following the success of this person-centred approach to vaccinations in Cheshire, a formal referral model has been introduced and widely shared, ensuring that families, carers and all services have a single front door through which to arrange bespoke support as the vaccination programme evolves.
I wanted to feedback on how much the service provided by the vaccination staff is needed. The young man we support is probably one of the hardest to reach patients for any medical services. He is 24 years of age, autistic and non-verbal with behaviours that challenge. In the past he's had to be sedated to access any care services such as dentists, etc., as he is so terrified of any medical intervention. This has meant that he has not been able to fully access medical services despite being entitled to reasonable adjustments. The challenge of COVID has brought this issue into sharp focus. We requested a COVID vaccination many times, but no one was able to tell us how this could be arranged until the GP practice put us in contact with a health facilitator who contacted the vaccination service. The vaccination staff worked very closely with his support team on desensitising him to her presence. She initially introduced herself at his home and gradually we took him in his car to the vaccination centres, where she would see him and offer sweets whilst climbing into the car. He's accepted this and we then progressed to her placing a pen and drawing on his upper arm. They were amazing and I cannot sing their praises high enough. She was popping in to visit him at the end of her working day and gently built up his trust. On the day of his first vaccination, he was relaxed and she was able to vaccinate him with a minimum of stress and no sedation. It is easy for patients, like the person we support, to be ignored, forgotten or fall through the cracks. The day that he was vaccinated was one of the best I've experienced as a care worker. Patients and working as a team meant that the very challenging and voiceless young man was able to access vital treatment. With the support of the vaccination staff, there is no patient that cannot be reached. Their work is vital for these patients, improve health outcomes and help to reduce health inequalities.